acquired by contact with blood, body fluids, non-intact skins, including rashes and mucous membrane. Start. So standard precaution work practices are applied to healthcare workers regardless of infectious status of the patients and to ensure a basic level of infection prevention and control. These measures should be followed whether the individual is infectious or symptomatic or not. All consider all specimen, blood, body fluid as infectious whether they are infectious or not, and all needles and sharps whether they appear infectious or not, they are treated as infectious. And the components of the standard precautions are: first is hand hygiene and personal protective equipment. uh, you people must I hope you people got to know what is standard precautions. Standard precautions are set of control practices used to prevent transmission of disease, and we have to consider all the individual as infectious, and all the samples as infectious whether they are infectious or not, and all the needles and sharps as infectious. Then come to component of standard precaution. The very important is hand hygiene. Hand hygiene is very important component foremost, and then personal protective equipment, then then appropriate handling of patient care equipment and soiled linen, then prevention of needle stick and sharp injuries, and environmental cleaning and spills management, and appropriate and last the appropriate handling of waste, that is biomedical waste management. Come to hand hygiene. Hands of the healthcare workers remain common mode of transmission of hospital acquired infections. Therefore, effective hand hygiene is cornerstone among all measures of preventing hospital acquired infection. Appropriate hand hygiene can minimize microorganisms acquired on hands during daily duties and when there is contact with blood, body fluids, secretions, and known and unknown contaminated equipment or surfaces. Single most effective action to prevent infection. The correct method is to ensure all surface clean. More important than agent we are using and the length of the time taken. Yeah, more important than agent used for hand washing and the length of time taken. Then come to microbial flora of the hand. There is a resident microbial flora of hand, and there is transient flora of hand. So, what is resident? Resident flora resides in the stratum corneum and also on the surface of skin. They are mostly non-pathogenic, and transient flora colonize the superficial layers of skin and they are pathogenic. Come to a brief difference between resident flora and transient flora. Resident flora resides on stratum corneum and on skin surface, and of course, they are normal flora, and they are non-pathogenic, and they are not easily transmitted, and they are difficult to remove. They are only removed by surgical scrub, and their reduction is indicated before surgery or aseptic procedure. Resident flora includes gypsum-whites, propionibacterium, or Cocculus negative Staphylococcus species. And what transient flora? Transient flora colonizes on superficial layer of the skin surface, and it's not the normal flora of hands, and they are of course pathogenic, and they are easily transmitted by direct or indirect contact, and they are easily removed by hand wash or hand rub, and their reduction is indicated during routine patient care activities. The transient flora include gram-negative bacilli, methicillin-resistant Staphylococcus aureus, methicillin-sensitive Staphylococcus aureus, vancomycin-resistant Staphylococcus aureus, vancomycin-resistant Enterococci, Clostridium difficile, norovirus. Then, when the hand hygiene is indicated, or the indications of the hand hygiene, you people must have heard many times my five golden moments of hand hygiene. What are my five golden moments of hand hygiene? There are five. One moment one, before touching a patient. Moment two, before any aseptic procedure, or moment three, after body spill or exposure, after body fluid exposure or rest, or moment four, after touching a patient, moment five, after touching patient surroundings. This is the diagram showing the five moments of the hand hygiene. One is before touching a patient, two, before any aseptic precaution procedure, before any aseptic procedure, after a procedure or body fluid or exposure, when there is exposure risk. Four is after touching a patient or after touching patient surrounding. So, moment one and four, that is, before and after touching a patient. Example, like when to practice moment one and four, before and after taking pulse, blood pressure, auscultation, and palpation, and after shaking hands, helping a patient to move around, and applying oxygen mask, and giving physiotherapy, or recording ECG, or use of gloves. And moment two and three are practiced before and after aseptic procedure or body fluid exposure, before and after oral or dental care, aspiration of secretions or assessing in situ drains, skin lesion care, wound dressing, administering injection, drawing of blood, drawing of blood or sterile fluid, handling of device like catheter, central line, endotracheal tube, or clearing up urine or feces or vomitus, or handling bandages, napkins, etc., installing eye drops, or moving from a contaminated body site to another body site during care of patient. And moment by that, that is 40 to 60 seconds. Indications of hand hygiene. Covering a cough or sneeze. A plain liquid soap is often used. This renders the hands socially clean and removes transient microorganisms. The hands are washed for 5 to 10 seconds with soap and water, and this type of hand wash is suitable for all routine procedures. Then come to step to reduce a surgical hand scrub. or hand wash. It aims to eliminate the transient flora completely and to reduce the resident flora significantly at the beginning of operation and transient local hand scrub is iodine. Use of warm water is recommended as the antisepsis and the soap works effectively. However, very hot water should be avoided as it causes dermatitis. It should be ensured that the tap water should be used for scrub should be clean and free from hospital microorganisms like Pseudomonas, Legionella, and your drying sterile single-use cloth towel should be used for drying hands. So I'm going to revise the duration of the hand hygiene. For social hand hygiene must be practiced for 5 to 10 seconds. Then hand rub must be done for 20 to 30 seconds. And what should be done for in medical practice? In medical practice, hand wash should be done for 40 to 60 seconds. And surgical scrub hand wash should be done for about 2 to 5 minutes. Fit. Then we'll secure by tying the top of the string behind the head. The upper string is tied behind the head. Then pull the bottom of the mask, fit closely and tie it high on. First, we remove gloves, then untie the strings and remove the mask, handling only by the string. You know, we don't body of mask. We will remove the hands by untying the or handling the strings only and dispose the mask into the waste bin. Decontaminate the hands. Then how to use N95 mask. Nose clip is located in the top panel. People have seen the nose clip is located in the top panel. We perform the nose clip. We fit the nose clip by gently bending at the center of the panel. है ना उसपे एक nose clip है उसको gently bend करेंगे और वो उससे अम, अम, उससे क्या होगा कि वो कवर हो जाएगी नोज ना ऐसे एंड करेंगे फिर turn over to the exposed headband step 2 and then we'll bring the respirator under the chin and pull strap over the head then Then locate the lower strap below the ears and upper strap across the crown of the head. Lower strap below the ear, upper strap across the crown of the head. Adjust top and bottom panel for a comfortable fit according to you. According to you, adjust top and bottom of the head of the mask. Then using both hands, mold nose clip to the shape of the lower part of the nose. Using both hands, like the girl in the picture is pressing the nose clip. Pinching the nose piece only by hand may result in less effective respirator performance. So always must pinch the nose piece with the both hands, and a seal the respirator on the face should be pictured prior to wearing in the working. Then there's a sequence donning and doffing. What is the donning? Waiting on the entire